Hi, it's Cami from Centra Marketing. We are going to continue our Live Well series. And so we are here at the Heart and Vascular Institute where we're going to learn about Heart Month and cholesterol. Hi, I'm here with Dr. Myers at the Heart and Vascular Institute, and we want to have a little conversation about cholesterol to help those who are listening to learn what is cholesterol, how do I get tested for it, all of the things. So what can you tell us about cholesterol and how we can test ourselves?
Well, first of all, cholesterol is kind of given a bad name because people associate it with disease, but actually is a very important molecule in the body. It's very important for production of steroids, vitamin D, many other cell-related functions. And so it's very important for function of our cells and body. But in excess, it can lead to disease. And the main thing that we worry about is atherosclerotic disease or coronary artery disease.
Okay. And how do you test for it?
Well, the main way to test for it, of course, is blood work. Just a basic lipid panel is the main test that we do.
Okay.
So pretty quick, easy
So like
test.
your PCP lab work, your annual lab work.
Correct, yeah.
Okay.
Most primary care physicians will check that annually.
So there are a lot of nuances surrounding cholesterol. There's LDL, there's HDL, there's good cholesterol, there's bad cholesterol. And like you said, I think a lot of us have been educated to just like high cholesterol is bad.
Right.
So how can you set us straight?
Yeah. Well, as you mentioned, we can't just know the total cholesterol number because we need to know the breakdown. A lot of people know what their total number is, but unless we know what the LDL is, which is the low density lipoprotein, which is a bad cholesterol, HDL is considered the quote good cholesterol. So those are the main components that we look at is the LDL and HDL. And then of course triglycerides are also atherogenic. So the breakdown is the LDL, we prefer that less than 100 in most people, and then HDL above 40. So those are the general numbers we use in somebody who's otherwise healthy without a cardiac history.
That's a lot of information. How do we better understand what is good, what is bad, and then how we can take these numbers that we're getting in lab work and actually do something about it?
Okay, well, like I mentioned, the LDL is considered the bad cholesterol. If you are otherwise healthy and your LDL number is less than 130, then that's probably nothing to worry about. It just needs to be followed every time, over time, and checked every 5 years or so. And then HDL, it's a good cholesterol, and some people say that's protective. There are nuances to that, though. If you have a very high HDL level, for example, over 70 or 80, that can mean that the HDL is dysfunctional. So there are very interesting nuances to it. So you just have to be careful about saying the HDL is always a good cholesterol.
Yeah. So what do we do if we find ourselves in a concerning place with low or with LDL or HDL, regardless?
Okay. Well, I'll mainly focus on LDL because we found that higher in HDL doesn't really help us clinically or prevent events down the line. But certainly LDL we need to worry about. First and foremost, we always emphasize a heart-healthy diet and exercise, really emphasize the lifestyle changes. That's first and foremost. We can get LDL, a lot of it's genetic, but you could probably get about, if you really change your lifestyle quite a bit, a 10% reduction in LDL.
Okay.
If you really go from a typical American diet to vegetarian, very low fat diet, you could probably get a 30% reduction. So lifestyle changes do play a role.
Okay.
If that's not sufficient, you still have significantly elevated cholesterol levels, despite the lifestyle changes, and at that point we might want to consider pharmacologic therapy, the mainstay being a statin.
Okay. It sounds like there are things that you need to do if you're combating a cholesterol issue. What about if you don't want a cholesterol issue?
Yeah.
So what preventative measures can we take?
Yeah, so if you have a good cholesterol level, but you want to prevent future events or future issues with cholesterol, I think the main thing is, again, eat a healthy diet, which would consist of low saturated fats. And the one that the American Heart Association recommends is a Mediterranean diet.
Okay.
And that is high in fruits and vegetables, of course, lean meats, fish, lots of fish, unsaturated fats such as olive oils, avocados, nuts. And so the Mediterranean diet is kind of what's been known to be the best diet to prevent future cardiac events.
Okay.
And then, of course, exercise 30 minutes a day at least.
Yes. There are rumblings of something called lipoprotein little a. What is that? What can you tell us about that?
Okay, well, that's a great question because that's kind of an emerging lipid level that we're starting to check, especially in patients that have cardiac events but don't really have any other risk factors. It's basically it's an LDL, it's a bad cholesterol particle with, some people say it's like LDL with Velcro on it. It's like a really sticky particle.
Okay.
And so it sticks to your blood vessels and contributes to atherosclerotic disease with coronary events and and also strokes. So it's like just a worse LDL particle.
Okay.
Currently, we can check it, and it's mainly genetic, so diet doesn't really affect it. So if you get it checked when you're 25, that levels can be there for life. And there's currently no medications for that, but they're currently in phase 3 trials. So hopefully in the next couple of years, we'll have a way to treat that.
Yeah, so very new development.
Correct, yes.
Okay.
Yeah, but something to look out for.